Prior to starting this video, for time's sake, I would just like to say that whenever you're conducting IV insertions, transfusions, and so on, you want to ensure that the patient has an order for these things prior to beginning. You want to make sure that the order is complete and that it's correct. And you want to assess the patient for any allergies that they might have that might contradict you from doing these things. And you'll also want to make sure that if it's applicable, that they have an informed consent on file. As for the actual application and for the actual insertion, you'll want to make sure that you have the appropriate PPE, so gloves, and if the patient has any infectious diseases or anything of that nature, then you'll want to make sure that there is the appropriate PPE being worn for those as well, if it's applicable. And you'll also want to conduct proper hand hygiene practices to help prevent infection. But for the sake of time in this video, I'm just going to put those as an assumed occurrence. And so that way it cuts down a little bit of time and just goes over the skills themselves. Prior to beginning an IV insertion for your patient, the very first thing that you'll want to do is gather all of your equipment, and then you'll want to check your solution to make sure that there are no abnormalities present within it. So you want to make sure that it's not expired. You want to make sure that it doesn't have any sort of puncture in it, it's not leaking, and so forth. And then from there, you will get all of your equipment set up. So like an IV insertion kit, you'll get your gloves, you'll get the fluids themselves, you'll get your tubing and anything else that might be necessary to insert the IV. And for starters, you'll want to clamp the IV administration set to make sure that you don't waste any of the medication anywhere into the floor or anywhere that isn't going into the patient. You'll want to remove the cap and you'll spike it. So you will just do like a forceful twisting method. And you'll want to make sure that you don't touch it, so that way you don't accidentally contaminate the top of it and cause any spread of infection. So after you spike it, you'll hang your bag up onto an IV pole. And then after you hang your bag, you'll want to kind of squeeze this drip chamber, and you'll want to fill it up about halfway through. And then you'll want to unclamp your the end of your line, and you'll want to let that fluid run through your line until there are no air bubbles present and until it has gone all the way through, and you'll get any and all air bubbles out of the tubing, and then you can close the clamp again. As for the IV, you want the patient to be in a low Fowler's position in the bed, and you'll want like a chuck or some other form of easy cleanup below the patient's arm. So maybe like a towel if you're in an outpatient facility or something of that nature. You're going to select and palpate for an appropriate vein. And if the site is hairy, then what you want to do is you want to clip around the entry site with a pair of electric clippers. And you don't want to use a razor though, because it could kind of lead to unnecessary infection if it's not done properly. The next thing you'll do is you'll put on gloves, and you'll want to apply a tourniquet about 4 inches above the site. So if you were doing one down here, then you would want your tourniquet to be up a little bit higher, because you don't want to get too close to it, just to make sure that you don't accidentally like burst the vessel, and you don't want to get too far away, because then it won't be as beneficial. From there, you'll have the patient lower their arm, lower than what their heart level is, and you'll have the patient kind of open and close their fist, so that way the vein will be a little bit better exposed. And then whenever you find the vein, after palpating and assessing for it, then you'll want to clean the site with chlorhexidine. You'll want to make sure that the site is completely clean, and don't blow on it, because if you blow on it, then you could get spit onto the site, and then it would essentially dirty it again, which could lead to infection. After cleaning it, you're going to wait for the chlorhexidine to dry, and then you're going to take your non-dominant hand and you're going to pull the skin, and not touching the insertion site or the site that you just cleaned to help again prevent infection. And you're going to pull the skin that's taut and back, so that way you can see the vein a little bit. You pull the skin back with your non-dominant hand, and then with your dominant hand, you're going to take the insertion needle, and you're going to hold it with the bevel side facing up, and you're going to go in at a 10 to 15 degree angle. And so then whenever you insert it, you're going to feel like a little bit of a give, and it's going to slide in, and then in your IV catheter itself, you'll see a little bit of blood flash. And so that's whenever you know that you are in the vein, and you'll want to go just a little bit further and then insert the catheter, separate. Most of them have like a little click that you can get, and it will pull the needle back into it, and then you'll dispose of that into your sharps container or per facility policy. And so after this, you're able to release the tourniquet if you want, just to make sure that there's like a little bit of blood coming out of there. And then you will flush the IV with normal saline. You want to make sure that there's no bubbling up around the site. You want to make sure that it's not burning the patient. And you want to make sure that it doesn't hesitate. After flushing, then you're going to put your dressing onto your IV. You want to make sure that the dressing is essentially a clear tegaderm, so that way you can evaluate the access site. And you want to assess for things like redness, evaluation, and so on. And you also want to, at the site, you want to make sure that you put the time and date on your dressing, or else it is going to be considered to be expired, and then you'll have to start all over. When it comes to changing an IV solution container or the administration set, again, the first thing you'll want to do is verify your order. But if you're using an infusion device such as like a pump, you'll want to pause it or hold it, and then you'll want to clamp off the set so that way it doesn't drip down out of the tube or anywhere else, again, that isn't into the patient. You'll open the cap of your set, but you don't want to touch the entry site. You'll spike the new set with the pushing and twisting motion like we talked about before, and you'll put the container onto the IV pole. You'll squeeze the drip chamber again until it's halfway full of the solution, and then you'll release the clamp, which will allow the solution to run through the new set until any and all air bubbles have been removed. You'll want to be sure to date and time your new set again, so that way you know your IV tubing isn't expired. And you'll want to clamp the set on the patient's IV tubing as well. You'll remove the current tubing from the patient's IV, and you'll remove that old tubing from the IV pump, and you'll dispose of this accordingly depending on your facility policies. From there, you're going to put your new tubing into your pump, and you're going to set your infusion rate. And then after that, you're going to scrub the access cap of the tubing with an alcohol wipe, so the tip of this, and the tubing to the access port. And so you're going to secure after that, after you connect the two, you're going to secure it with tape as needed. And then from there, you'll open the clamp to the IV and the infusion set, and then you'll start the infusion back. After this, though, you want to assess the site and make sure that everything looks well, ensure that any clamps are undone, and make sure that the solution itself is running. You also want to double check with the patient and make sure that they aren't experiencing any adverse effects. If they are experiencing, a burning sensation, or if you notice that the site is infiltrated, then you'll need to remove that IV and then set a new one elsewhere. As for monitoring an IV site and the infusion, you'll want to monitor an IV infusion every hour, or whatever policy that your facility has established for you. Sometimes if you're infusing medications or blood, these checks occur more frequently. So you'll want to make sure and check that all the clamps are open and it's not blocked off anywhere, whether that be in the access to the patient or the access to the IV pump. You also want to observe the dressings and assess for any leaking of the IV fluids, or make sure that they aren't saturated with blood or anything of that nature. You'll want to inspect the site for things like swelling or redness, or see if it feels warm. You want to monitor for signs of infection, such as pus or redness again. You'll observe the IV site for any swelling or pallor or any other signs of infiltration. And then you'll also want to check with the patient to make sure that they're not experiencing any pain or discomfort at the site, such as burning. However, if they say that it feels like it's like a dripping sensation, or if they feel like they can taste it, then you know that it is being administered properly and that it is in the vein. Whenever it comes to changing an access site dressing, the first thing that you'll want to do is check to see if the dressing is saturated, and make sure that there aren't any signs of infection or inflammation or infiltration. If you find this, then you won't even want to change the dressing. You'll want to actually just relocate the IV. But you'll want to pull the dressing in a perpendicular fashion that's towards the insertion site. Whenever you're removing the dressing, though, you want to make sure that you are stabilizing the IV to avoid unintentional removal or dislodging the IV itself, just because it might stick to the dressing. Again, so you'll want to inspect the site after that for any abnormalities, such as infection or infiltration, or any other complications that the patient might be experiencing. And you'll clean the site with chlorhexidine in a back and forth motion, and you'll wait for it to completely dry. And again, you don't want to blow on the site because it is essentially contaminating your cleaning. After this, then you'll reapply your dressing as before with a transparent dressing, dating the time, the change with your initials, and you'll want to anchor down any excess tubing with a tape. Some facilities prefer to tape like upwards, so that way you don't accidentally dislodge. It's just per facility preference. After this, you'll check with the patient to ensure that they're not experiencing any discomfort, and then you'll dispose of the old dressings as per facility policies. Whenever it comes to capping for intermittent use, your first move again is to assess the IV site. You'll always want to be assessing the IV site no matter what you do. If you're using an infusion device like a pump, then you're going to want to stop that pump and you're going to want to clamp off the set, and you'll also want to clamp off the IV set to the patient's arm. Whenever you remove the attached tubing from the container, normally they occur in a twisting motion, you'll use an alcohol swab to scrub the connectors on both ends and allow for it to dry, especially if you're going to be reconnecting the other one. You'll want to insert a saline flush and flush the line accordingly. You'll also want to make sure that there's not a bubble in the top of the saline. This is also a good time to aspirate for blood return. You'll want to flush the line and remove the syringe and then reclamp the tubing. And then you'll use an alcohol swab and clean again and attach any disinfection cap at the end of the tubing. Most of them are a bold color, such as like a green or a blue. Whenever it comes to administering a blood transfusion, again, the very first step that you want to take is to verify the order. You'll also want to obtain the blood, scan the barcodes, and do verifications prior to any sort of transfusion being conducted. This requires at least 2 nurses to verify the blood product. And you also need to check things that are in the order, like that there's an informed consent, that the patient's ID matches up, that the blood type and the expiration date, and you want to check the product itself just to make sure that it doesn't look like it's expired, such as like any blood clots that are present. And then you'll want to get a baseline vital sign set prior to the transfusion, so that way you know about your range of what to expect during the transfusion. Like other infusions, you'll want to clamp the lines, you'll want to spike it and hang it, put it on the pole, squeeze the drip chamber, and then connect it all and start the administration. You'll want to start it very slow just to see how the patient reacts to it at first. You want to make sure that they're going to tolerate it, and you definitely want to make sure that the patient vocalizes any abnormal effects that they might be experiencing, and you want to continue to assess them to make sure that they're not experiencing any signs of infiltration, or just that they're overall taking the transfusion well. You want to get another set of vital signs 15 minutes later, or for per facility policies, depending on, if your facility requires you to do it sooner or later. Whenever you observe the patient after 15 minutes and they seem to be tolerating the infusion well, you can increase the infusion rate to the prescribed rate. You just always want to start it off slow just to ensure that the patient is going to accept the transfusion well. And then you can speed it up from there as needed. And whenever the infusion is complete, you'll want to clamp the lines, you'll want to get another set of vital signs, and then you'll want to assess the IV site and dispose of the blood equipment that's according to the facility policy. And then you'll want to continue to closely monitor the patient for any reactions that consequently occur from the transfusion that might be like a delayed or a later reaction. And as a side note, you also want to make sure that the patient has an IV that's large enough for a blood transfusion. So chances are, if you're going to transfuse blood, you would probably struggle if the patient's catheter size was a 24 gauge. But for a blood transfusion, you want to aim somewhere between an 18 to 20 gauge catheter for that. So whenever you are changing the dressing and flushing a central venous access device, you'll again want to verify your order. And then you'll want to put, after you get everything all set up in your room, you'll want to put a trash can close by for your convenient usage whenever you're performing this dressing change, just so that way it's easily accessible for you to be able to throw away the old contaminating dressing without contaminating your sterile field. So you'll want to put a mask on yourself because this is a sterile process, and you'll also want to put the patient, having them with their head facing away from the dressing change site, and if applicable, sometimes you can also put a mask on the patient. You'll want to set up a sterile field on the bedside table for the dressing change, and then you'll want to apply the clamp on the access site. You'll put on clean gloves to assess the insertion site, and you'll palpate it for any tenderness. And then while you are holding and stabilizing the catheter, you will remove the dressing and you'll pull again perpendicular to the skin toward the insertion site upon removal, and then you will throw the contaminating dressing away into the trash can. You'll remove your stabilization device that it needs to be changed, so sometimes they might have like a little circle onto the side here that you'll throw away and replace as well. And then after this, you will take off your gloves and perform hand hygiene and put on sterile gloves. With the sterile gloves and with a sterile antimicrobial wipe, you will wipe off any old blood that might be around the site. And then you will clean the site completely with chlorhexidine in a gentle back and forth motion, and you'll wait for it to dry completely. And then after that, you will apply your antimicrobial dressing, and then you'll apply any sort of applicable skin protectant in the area. You want to make sure that the application of the dressing, that the catheter extends out of it, that you will want to make sure that the access site extends out of it, so that way you can get it and it's not stuck underneath your sterile dressing. You replace any end caps that might be indicated after cleaning them with the swab and allowing for them to dry, so they might have old blood on them or whatever, and you'll want to clean that off as well. Allow for it to dry and then put it on. After it's dried, you can insert a saline flush, and you'll want to push it once the clamp is undone, and you'll want to look for any resistance or any sluggishness that might be indication of needing to change your IV. And then you'll want to pull back and aspirate and look for a blood return. So after you get done flushing, then you'll want to remove your syringe and you'll clean the tip, or as my facility says, scrub the hub. And then you'll apply a cap onto the end of each connector after it dries. So whenever all of this is all said and done, again, you'll want to label your dressing change with the date, the time, and your initials. And you'll resume any infusions as they are indicated. And then you'll want to ensure that the flow is accurate for an IV, and you want to make sure that the patient is responding appropriately. So you'll continue to assess and make sure that they aren't experiencing any signs of infiltration or experiencing any signs of not tolerating an infusion well. Whenever it comes to accessing an implanted port, you'll want to verify all your orders. You'll want to put on any applicable PPE and so forth. You'll want to see if the patient is applicable for a local anesthetic, which you need to apply to the area around the port before accessing, and you'll want to give that plenty of time for it to work prior to accessing the port. You'll want to put a trash can close by for the procedure, and you'll want to adjust the bed so that way it's comfortable for both parties. You'll want to apply a mask, and then you'll also have the patient either turn their head or they can also apply a mask as well. You'll set up a sterile field on the bedside table, and then you'll put on clean gloves and you'll palpate for the location of the port and assess the site of it. After this, you'll want to throw away those gloves and then put on sterile gloves. But you will then connect the connector to any extension tubing. After that, you'll use an alcohol wipe and you'll scrub a connector and then allow for it to dry, the other end of it. And then you'll attach a syringe and fill the tubing with saline, and then you'll clamp that. You'll then clean around the port site about 2 to 3 inches out from it using chlorhexidine. You'll allow for that to dry completely, and then with your non-dominant hand, you'll locate the port and palpate for its edges. And then whenever you find those edges, you'll hold the port stable and keep the skin taut. You'll visualize the center of the port, and you'll want to get a non-coring needle and hold it at a 90-degree angle whenever you're inserting it. And then you'll want to insert it all the way until the needle hits the back of the port. And then with an alcohol wipe, you will scrub the connector and insert the normal saline syringe. You'll open the clamp, and then you'll flush it with about 5 milliliters of saline. And then you'll observe the site to see if there are any leaks or any infiltration, and you'll make sure that the patient isn't experiencing any discomfort or any pain. And then you'll pull back slowly and aspirate for a blood return. If that's present, you'll then continue to flush accordingly per facility policies. And then you'll apply any applicable skin protectant around the site, and then you'll apply dressings that are also applicable to the facility policies. And after this, you'll put a cap on the connector after you clean that. And then you will again assess the patient for any discomfort, make sure that they are not experiencing any, and then after that you will remove all the equipment and clean up your sterile field. So whenever you are de-accessing an implanted port, the very first thing that you want to do again is verify your order prior to continuing. Then after all that is said and done, you will adjust the bed into a position that is comfortable for both parties. You'll put on gloves and you'll use an antimicrobial swab to scrub the needleless connector and the extension tubing for the cap, and then you'll allow for it to dry. You'll insert some normal saline, you'll unclamp the tubing, and you will check for a positive blood return. So if that is present, you'll flush the line accordingly to your facility's policies, and then you'll remove the syringe, scrub the hub, let it dry, and then apply a cap and clamp it. You'll then remove the dressing, and then you'll assess that dressing prior to discarding it. You'll want to look and see if there are any signs of infection. You'll want to assess for any drainage that needs to be noted and so forth before you throw that away. That's very important. You'll stabilize the port with your thumb and your forefinger of your non-dominant hand. And then with your dominant hand, you're going to grab the wings and you're going to firmly and smoothly pull the needle straight up at a 90-degree angle. So then you'll want to apply some pressure on the insertion site with some gauze. And then if it is oozing, you'll want to put a bandage over that. Otherwise, a dressing isn't necessary after the removal. And then you'll want to assess your patient to make sure that they're not experiencing any discomfort. And then if they are not, then you will dispose of the needle into the sharps container, clean up, and then assess your patient again for any discomfort prior to leaving. So whenever you're administering medications through an IV bolus or push through an IV infusion, the first thing that you want to do is gather your equipment. You'll check your order, you'll clarify any inconsistencies, you'll check the patient for any allergies, and you'll always want to know any sort of actions or considerations, your nursing actions. You'll want to know your safe dose ranges, and you'll want to know the purpose of your administration and any adverse effects that might occur due to the administration of this drug. And you'll always prepare your medications one at a time for one patient at a time to ensure that you don't confuse them. You'll perform your second check here whenever you're preparing these medications, and then you'll withdraw your medications from a vial, and then you'll do your third check. Then you'll want to lock any medication system that you have been using to obtain these medications prior to leaving it. You'll then take your medications to your patient directly and ensure that the patient gets their medication at the correct time. You'll identify your patient and you'll compare that with their MAR. You'll check their ID band, their ID number, their birthday, and any other forms of identification per your facility's policies. You'll perform any assessments that are necessary prior to administration of the medications. You'll check the patient for any allergies, and then you'll educate them for what these medications are, why they're receiving them, how much they're receiving, and so forth. You'll want to assess the IV site for any infiltration or any other complications prior to administration. And if applicable, you'll want to pause their infusion pump. You'll want to scrub the hub and allow for it to dry. And then using a saline flush, you'll test for a positive blood return. And if that is present, then you will flush per the facility policy. And then you will remove your syringe and use a swab and allow for that to dry. You'll uncap the medication syringe. You'll insert the syringe into the connector, and then you'll inject the medication at the recommended rate. During the administration, you'll want to observe the infusion site. You'll want to assess the patient for any adverse reactions. And if these were to occur, you would stop the infusion immediately and then contact the healthcare provider. And then after the infusion is completed, you will detach the medication and scrub the hub with a new wipe. And then you'll allow for that to dry, and then you'll flush it with saline at the same rate that you administered the medication. And so then whenever that is done, you will remove the flush and you'll scrub the hub again. You will unclamp your infusion, and then you'll restart your infusion rate. And then you'll want to immediately document the administration of this medication immediately after the administration has occurred. And then you will want to, again, assess your patient and evaluate their response to the medications within an appropriate amount of time. So, reassess vital signs within 15, 30 minutes. And then you'll want to document that as well, because if you didn't document it, you didn't do it. Whenever you're administering medications through an IV bolus or push through the medication of like a drug infusion lock, again, you'll check your order and you'll know all your actions. The same steps are the ones that are leading up to the IV bolus that were covered in the previous skill. But prior to all of this, you will complete any assessments that are necessary prior to administering your medication, and you'll double check the patient to make sure that they don't have any allergies. You'll assess the IV site for any infiltration or the presence of inflammation that might be present. Then you'll use a swab to scrub the hub. You'll allow for it to dry, again, not blowing on it. You'll uncap your saline flush, and you'll insert the saline flush into the access port of your lock. And then after this, you'll remove the clamp of the tubing, and you'll pull back on your syringe, and you'll want to check for a positive blood return. And if this is positive and present, you'll flush the line according to your facility policy. You'll want to observe the insertion site whenever you're inserting the saline to assess again for any infiltration and assess the patient for any discomfort that they might be experiencing, or just to check and see if there's any resistance that is being met. After this, you will remove it and then scrub the hub, allow for it to dry, and then you'll insert your medication syringe. You'll inject the medication at the recommended rate, and then if you meet any resistance, don't force the medication. Whenever you're administering the medication, you'll want to observe the site, and you'll also want to observe the patient as well to assess for any adverse reactions that might occur. And if these adverse reactions do occur, then you'll want to immediately stop your administration, and you'll want to notify the healthcare provider. Whenever you remove the medication from the port, you'll scrub the hub again, and whenever it dries, you'll uncap the saline, and then you'll flush that. You'll want to flush it at the same rate that you administered the medication. And then whenever you scrub the hub again, you're going to cap it, and you'll discard accordingly. And then you'll document your medication administration in your MART immediately after doing it. And then you'll also want to document the patient's response to the medication. And this needs to be done within an appropriate amount of time.